I'm Kelly Lemke with Maryville University, and I'm going to be doing my head-to-toe assessment on Kaylin. I've asked her to empty her bladder to put on something more comfortable. We have assessed her vital signs, took height and weight, which were all within normal limits, and I have washed my hands and we're ready to begin now. We've also done the distance and near vision, distance using the Snellen chart and near using the Rosenbaum. Okay, the first thing I'll do is start with inspection. I'm inspecting her head for any abnormalities, any masses. I'm looking for placement of her eyes and ears and nose. And then I will palpate the scalp, again looking for any abnormalities, any masses. Her scalp is freely movable. Her hair does not come out. She has no alopecia. Her hair is healthy, not brittle or dry, doesn't break off easily. Okay, eyebrows are full. I'll also palpate the facial bones. And then palpating the sinuses, any tenderness when I do that?
No.
Okay. All right. I will do, let me go ahead and have you clench your teeth. Okay. Smile real big. Okay. Stick out your tongue. Puff your cheeks. Okay. Close your eyes real tight. Wrinkle your forehead. Okay. All right. And then I'm going to check for sensation. Close your eyes and tell me if you feel this on both sides.
Yes. Yes. Yes.
Okay. All right. I'm looking now at her eyelashes. They turn out and away from the eyeball. I'm going to inspect the conjunctiva and the sclera. Looking for nice pink, moist. And it's there. Okay. I'm going to have you cover your right eye and uncover. Okay. And looking for any movement that should not be there. And go ahead and do the same thing with the other hand. Okay. All right. Cover your right eye. And tell me when you can see my fingers.
There.
Okay. Change.
There. There.
Okay. All right. Checking for, that was checking for peripheral vision. Okay. Now we're going to look at direct and consensual. And consensual. Okay. Direct. Consensual. Okay. All right. I want you to look at the end of my pen, and we're checking for any extraocular movement. And none's noted. Okay, now we'll look at the ears. And we're looking for symmetry and placement on the side of the head, and that looks good. Okay. Okay. Any tenderness when I do that?
No.
Okay. All right, we'll do the Weber test. Tell me if you can hear this in both ears or just in one.
Both.
Okay. Now we're going to do the Ren test, and I'm going to place this on the mastoid bone. Tell me when you can't hear it.
Can't hear it.
And tell me again when you can't hear it.
Can't hear it.
Okay, and air conduction should be twice as long as bone conduction.
Can't hear it. Can't hear it.
Okay. That's good. All right, we're going to do the whisper test. I'm going to have you cover your right ear. And I'm going to whisper a word and you tell me what I have said.
Orange.
Okay, cover the other ear.
Apple.
Okay. And now we'll go ahead and inspect the temporal membrane, looking for a pearly gray. Okay. Okay, and that looks good. Ear canals are clear. Okay. Now I'll look at the nose, and it is midline. Placement is correct. And I will go ahead and have you occlude one side, and we'll check for patency. Okay, and then do that on the other side. Okay, any difficulty breathing? Okay. All right, then I'm going to look at the septum and the terminates, looking for pink, moist. Okay, and that's what's seen, and no edema is found. Okay, now we'll move on to the lips, looking in it for any cracks or fissures. And then are seen. Go ahead and open your mouth. Look up. Looking at the hard palate and the soft palate, the teeth. Say ah. Ah. Tonsils are present. No redness is seen. Uvula is midline. Tongue is also midline and pink. Looking at the floor of the mouth and under the tongue, no ulcerations or masses are seen. Teeth are healthy. No odors. Okay. And go ahead and stick out your tongue. Let me check your gag reflex. Okay. Okay. Now we'll move on to the neck. Before we do that, we'll go ahead and palpate lymph nodes. Preauricular, postauricular, the occipital, postcervical, tonsillar, the submandibular, submental, superficial, deep cervical, and the supraclavicular. Okay. All right, and now we're going to look at the neck. I have you turn your head both ways. Okay. Put your ear to your shoulder. Okay. Chin to chest and look up. All right, I'm going to have you do the same thing against pressure. Okay. Okay. Shrug your shoulders. Okay. Okay. All right. And now I'm going to check the placement of the trachea. Okay. All right. I'm going to check the carotid one at a time. All right. I'm going to move the thyroid over and have you swallow. Okay. Okay. All right. And the thyroid is smooth and it moves freely when she swallows. I'll now use the bell of my stethoscope and listen. Have you hold your breath. Breathe. Hold your breath. Listening for any bruise in the carotids. And the same thing with the thyroid. Breathe and then hold your breath. Okay, go ahead and breathe. Okay. All right, the next I will look at the upper extremities, looking at the skin. Anytime I'm inspecting, I'm always looking at skin color, looking for any abnormalities, checking for skin temperature, looking at fingernails for any clubbing, discoloration, good capillary refill, less than 3 seconds, checking pulses, radial, brachial. And I'll have you extend your arms out and I will check the axillary nodes. Okay? All right. Next thing I'll do is inspect the posterior chest. Again, looking at skin, checking temperature, looking for any abnormalities. I'll have you say 99
99,
to check for tactile frontis.
99, 99, 99, 99, 99, 99, 99.
Okay. And then I will have you breathe in and out, deep breath. Okay, let's do that one more time. Okay, and there is symmetrical chest wall expansion. Okay, and I will now check for CVA tenderness. Any tenderness when I do that?
No.
Okay. I'll now percuss. Checking for resonance, making sure there's no dullness. Okay. I'll have you take a deep breath and hold it. Checking for diaphragmatic excursion now. Okay. Now take a deep breath, let it out, and hold that. Okay. And that should be 3 to 5 centimeters. And that would be marked on both sides and checked on both sides. Okay. Now I will listen to your breath sounds. Take a deep breath. And I'll do this in a symmetrical fashion. Across and down. And back across, comparing breath sounds from side to side. Raise your arm up just a little bit. Deep breath. Okay. Okay. Breath sounds are clear, no wheezing, crackles noted. Okay. I'll come back to the chest. I'm looking for any asymmetry, any abnormality, any pulses, any heaves, anything out of the ordinary. Okay. Have you say 99?
99, 99, 99, 99,
Again, checking for tactile fringes.
99, 99,
Okay, raise your arms up.
99, 99.
Okay. All right. I'll now percuss the lung fields. Again, going from side to side and down, listening for resonance. Raise your arms for me. And now we'll listen to breath sounds again, side to side and down, comparing as I go. Okay, there's your arm. Okay, breath sounds are clear. I'll now listen to the heart sounds, starting with the aortic. Pulmonic area. Herb's point. Tricuspid. And mitral. Okay. And no rubs, clicks, or any other abnormal sounds are heard. I'll also look to make sure there's no jugular vein distension seen in the area of the neck. Okay, I'll go ahead and have you lay down. And I'll inspect the abdomen for any abnormalities, any unusual pulsations, or anything, and seeing none, I will auscultate vowel sounds. In all four quadrants, and if I do not hear anything, I'll listen for at least 3 to 5 minutes. Okay, now I'll listen over the aorta, iliac and renal branches, and the femoral. And no bruise or any abnormalities are heard. Okay. I will now percuss for the liver borders. I'll first percuss the abdominal areas, checking for resonance and noduleness, which would mean masses. Okay. Okay. All right. And liver borders are noted. Checking for splenic. Okay. Now I will lightly palpate. Any tenderness noted on palpation? Okay. And I'll have you take a deep breath. Let it out. Okay, do that one more time. Checking for liver border and splenic border. Same thing, deep breath and let it out. Okay. And now palpate for kidneys also. Okay. Now deeply palpate the abdomen. Any tenderness noted?
No.
Okay. And then I will check the aorta. Any pulsations? Then I'll have you sit up like you're going to do a crunch so I can check the muscles in your stomach. Okay? And no hernias noted. All right, you can go ahead and sit up. Okay. We'll now move to the lower extremities and looking for any abnormal muscle tone, any edema, any abnormal hair distribution, and none is noted. I will check the popliteal pulses, dorsal, pedal. Okay. I'll then check reflexes, the brachial reflex. Okay. I'm just looking for a slight movement in that brachial muscle. Okay. All right. The knee reflex. Okay. And the Achilles. Just relax your foot. Okay. Relax. Okay. All right. I'll have you pull against my hands. Okay. Push. Checking muscle strength, which is good. Put your arms out to your side. Push up. Push down. Okay. Straight out in front of you. Push down. Okay. And push up. Okay. Good muscle strength of the upper and lower extremities. Okay. And I'll have you step forward, lean over, checking your thoracic and lumbar curvatures, which are normal. Okay, now have you stand up and walk across and back. Okay, and gait is normal. Go ahead and have a seat. Okay, and this will conclude my head to toe examination.